Dr. Kecia Gaither is a double board certified physician in OBGYN and maternal fetal medicine. She holds a master's degree in public health and an MS MBA in healthcare policy and research healthcare leadership. Dr. Gaither's expertise is grounded in both research and her professional experience in caring for women with multiple surgical, medical, and fetal conditions in pregnancy. In her current role, Dr. Gaither serves as the Director of Perinatal Services and Director of Maternal Fetal Medicine for New York City Health and Hospitals Lincoln in the Bronx. She is also Associate Professor of Clinical Obstetrics and Gynecology with Cornell Weill Medicine. As a Harlem native, Dr. Gaither's mission as a medical professional is to offer exemplary prenatal care to all women, regardless of circumstance. She regularly lends her commentary and expertise on issues pertaining to women's health, pregnancy, and environmental population health policy to leading national consumer health and lifestyle outlets across print, radio, TV, film, and online. And she is a reviewer for and has been published by multiple scientific journals. Dr. Gaither is a member of several professional organizations and has received numerous awards and honors, including America's top obstetrician and gynecologist from the Consumer Research Council several years in a row. Welcome, Dr. Gaither. Well, welcome, Dr. Gaither. Thank you so much for joining us on a Saturday and taking time out of your very busy schedule to talk about vitamin D. And I just wanted to start by asking you, what motivated you so much to take time out of your day? You're a very busy doctor, you're a very busy individual, to talk about vitamin D with us.
Well, vitamin D is one of my loves, simply because it is a very inexpensive vitamin. It is involved in a lot of the homeostasis of our bodies. And being a maternal fetal medicine specialist, I see the impact that it has on my pregnant population, particularly in regards to preterm labor. So I'm always
That's
available to talk about it.
that's great. Okay, well, if you wouldn't mind, just kind of describe a little bit about your day-to-day in practice and what it is you do.
Okay, I'm a maternal fetal medicine specialist. I am the director of perinatal services and maternal fetal medicine at New York City Health and Hospitals Lincoln in the Bronx. Uh, the Bronx is a part of New York State that has one of the highest uh, perinatal statistics for adverse morbidity and mortality in New York State. We see a lot of high risk pregnancies, a lot of substance abuse, a lot of obesity, a lot of cardiovascular disease, a lot of preterm births. So, with that being said, some of the things that I think are important to help decrease the findings of these adverse perinatal outcomes is to implement a few things that, you know, would help to decrease it. And vitamin D is one of those.
Right, and it is just one, but among all the other components of health, do you think it's one of the most important?
Personally, as a maternal fetal medicine specialist, yes, I think it's a very important component.
Mhm.
Again, it is inexpensive, readily available, but the benefits from a whole body standpoint are you just can't beat it.
Right, right. And what initially brought your attention to the importance of vitamin D?
I just happened one day, and this, when I say one day, this was a while back. I was doing some research into um, vitamin deficiencies as they relate to perinatal outcomes and came across a whole host of things on vitamin D and just kept reading and reading and reading. And it just made sense. Why not screen for nutritional deficiencies? And particularly in my demographic, I think that was really important to do. And just to check everybody's level and to augment, supplement their nutritional deficiency with vitamin D.
And what do you look at in terms of defining sufficiency? What level of vitamin D do you aim to achieve among your prenatal patients?
Well, different labs will have different levels as far as what is deemed adequate. I look for 30 nanograms and
Okay.
above. And above.
And then how do you determine a dose?
I typically start with 1,000 micrograms a day, and I find that is sufficient, unless they have levels in single digits. At which point, then I'll give them a mega dose of like 50,000, and then taper it off to 1,000 a day.
Mhm. Okay. All right. So how long have you been implementing vitamin D into your practice?
Hmm. I'd say for a good 10, 15 years, a while.
And what is the lowest level that you've seen?
Probably 6.
Okay.
And, what I have found in those women that have levels less than 10, there generally is a psychiatric component associated with that, I found.
Such as,
Bipolar, schizophrenia, severe depression, schizoaffective disorders. Mhm.
and do you find that vitamin D, perhaps the patients that you see their levels improve, do they even have less risk or less occurrence of postpartum depression?
I think it kind of levels them out, of course, in addition to the input from psychiatry. But I do think that there is a balancing out of mood. So, at this point, I'm at the process of working with some of my psychiatric colleagues and really looking at that from a scientific point of view, and hopefully having some concrete evidence that it aids in stabilization of mood.
Back to the levels, how concerned are you with vitamin D toxicity?
Not concerned at all.
Have you ever seen any vitamin D toxicity in your
No,
practice? No. Okay.
no.
All right.
Mhm.
And what other factors, such as lifestyle, co-nutrients, do you feel are important to consider along with vitamin D for your prenatal patients, especially your high risk?
I think we need to ensure that they have adequate iron supplies. So certainly iron supplementation is of paramount importance. If there's a history of neural tube defects, your folate, of course, is also important with your sickle cell patients. So if we're talking about at a basic level, your iron, your vitamin D, and if there's something else that's going on, then you adjust accordingly. But at its most basic, iron, prenatal vitamins, and vitamin D supplementation. And
Okay.
hopefully your vitamins have your omegas and everything else in it that's beneficial for uh, fetal brain development.
Right,
Mm.
right. Yeah, but of course, it sounds like vitamin D is on your essentials list,
Yes, it
which
is.
is.
Everybody gets checked that comes in to see me. Yeah.
And how often do you retest? Do you retest to make sure that their levels are responding well to the dose?
I typically don't recommend retesting until probably it all depends on when they come to see me.
Mhm.
So if they come within the first trimester, then perhaps at the end of the pregnancy, towards 36 weeks, when we do 36-week labs, that might be a retest to see if we're adequate. If not, then in the postpartum period is sufficient enough.
Okay, okay. And how often do you find that vitamin D is deficient postpartum?
I haven't found it, to be truthful. I have not found that.
That's good to hear.
Hmm.
Yeah. So, Do you educate your patients differently in terms of vitamin D supplementation after they've had their baby? Do you have them, because we've got the American Academy of Pediatrics that's telling all the pediatricians to, uh, give the babies the D drops. I know Dr. Carol Wagner and Bruce Hollis have recommended supplementing the mom with daily vitamin D3 to get that same amount of vitamin D into the breast milk. What is it that you recommend to your postpartum moms when it comes to vitamin D?
I leave that to the pediatricians to have that discussion. Um, because honestly, after the baby's out, my job is done.
Okay.
So
Uh,
that's the arena for the pediatricians.
mhm. Yes, yes. So I'm curious, just in terms of your own observations, before you became aware of or began testing all of your mamas for their vitamin D levels, compared to after you started, did you notice any difference in terms of your own patients' outcomes and overall health, just observationally?
Um, Before knowledge of vitamin D, I mean, if you don't know, you don't know. You know what I mean?
Mhm.
But once you have some background, once you have a platform of knowledge, and then you're actually observing, then you can kind of see how it impacts. For instance, if you look at my population of patients in the high risk clinic, just in and of itself, there's not a lot of preterm labor among the patients that I take care of. I mean, it really isn't. It really isn't a lot of preterm labor, as opposed to if you look at, outcomes with, you know, other facets like the generalists, that there is observationally, there's not a lot of preterm labor in my cohort.
Now, you mentioned to me that you were interested in doing research
Mhm.
among your patients. What would this research look like? How would you design the study? What outcomes would you be looking for? And how would you be measuring dosing and tracking vitamin D? How would vitamin D fit into that?
You have a cohort of patients that have psychiatric illnesses, that have been under the care of a psychiatrist. Um, and, you would have a background of symptomatology, see what their vitamin D levels are at the start, and then follow them throughout their pregnancy along with the psychiatrist to see whether or not there's a diminution of symptomatology and correlate that with their levels. I think that would be kind of the easiest way
Mhm.
to take a look at that. Outcomes would probably be incidence of preterm labor, incidence of cardiovascular phenomena, diminution of symptoms. Those would probably be my three variables right at the start.
You do a lot of work with policy. You're a big speaker. You're on the news, it looks like, all the time to talking about maternal health. And if you have a key message about vitamin D that you wanted to really emphasize to individuals, to practitioners, to public health authorities and policymakers. How would you structure that key, that pitch that you would give them?
Vitamin D is important not only for pregnant women, but really for everybody. Um, it is a readily available, inexpensive vitamin. And there's so many bodily systems that it impacts in a very positive manner. It impacts mental health, immunocompetence, bone health, cardiovascular health, and in my line of work, decreases the incidence of preterm labor. So if I had to make a pitch, it's inexpensive, readily available, and it's probably the best choice um, to have to take care of so many things in the body. It maintains homeostasis with a lot of organ systems. So if that was my 5 seconds of fame, I would be promoting vitamin D for all of those reasons.
Yeah. Safe, inexpensive, easy.
Readily available.
Right. And there's research showing that it also improves, fertility and
It
decreases
does.
the risk of miscarriage. So you're right, it
Mhm.
really is important, not just for pregnancy,
Right.
but throughout the life cycle. Um, in your professional opinion, what impact could implementing vitamin D protocols into practice have on cost effectiveness in terms of reducing hospital costs, reducing patient costs?
I think it would have a really big impact, particularly when we start talking about the cost of prematurity,
Hmm.
um, the cost of being in the NICU, the cost of being admitted for psychiatric issues, the cost of adverse cardiovascular events. If you have something that is really not expensive, it really isn't. If you have something that is readily available, you don't need a physician's prescription to get some vitamin D. And if it's a policy whereby it's advised because it offers so many positive benefits, I don't see why it's not something, again, that's, you can't say a mandate, but that is strongly recommended.
Right, right, exactly.
Yeah,
And vitamin D is not new. The
it's not.
research has been around for decades. So,
Yeah.
in your opinion, what do you think is keeping more doctors like yourself, more hospitals from doing something about vitamin D, from measuring levels and suggesting supplementation and not just improving the health outcomes among their patients, but also lowering costs?
I think that the knowledge of it might not be as pervasive, particularly to those that hold the monetary lines in health systems. I think if that message of having just a very simple, inexpensive supplement provided, which could potentially decrease um, adverse medical issues resulting in length of stay, resulting in all the things that go along with prematurity, etc. I think there would be a rethinking of its utilization. So I think the message needs to be had among those that hold the purse strings, those stakeholders. I think that's kind of where we need to be.
Mhm. And in your experience, have you run into any hurdles yourself within your practice or at the hospitals that you work in when recommending vitamin D or when doing the testing? Have you seen any issues with what you're doing or anybody having
No,
issues?
insurance will pay for it. I mean, most of the patients that I see are Medicaid patients. And certainly we have a small percentage of, private insurance, but I have not come across any denials for evaluation, laboratory wise. Um, it's on our pharmacy board, so there's no issues with obtaining it. So, I haven't come across any barriers.
That's great to hear.
Hmm.
And how receptive are your patients when you're educating them about vitamin D? Do you feel like most of them hear you and
Yes.
actually get the supplements and take them,
Yeah.
and that's
Yeah.
great.
Particularly when I start talking about what it does not only for them, but for baby. Particularly in the time of COVID, yeah, we really had those conversations about immunocompetence acceleration. And, when a woman is pregnant, that's a really good time to have conversations because they really hear what you're saying and there's a huge buy-in because they want to do what's best for their little pumpkins. So, that's really a good time to have those kinds of conversations when she's pregnant.
Hmm. Yeah, yeah. Well, I am incredibly appreciative of you, of your finding vitamin D and pulling it into how you approach patient care as a doctor, because you know there's a lot of people, a lot of other doctors who might be aware of vitamin D for their own health, but haven't yet translated that into their practice. And so thank you. I applaud you
Thank you.
for doing that. Just a couple more questions. Do you have any personal stories about your own health and vitamin D that you would like to share?
Sure. When I first started delving into it and reading about it, I said, let me check my own levels. And come to find out, they were low too. So, and I found that by taking vitamin D on a regular basis, I have noticed, particularly at that time, um, more energy, less opportunity for me to catch colds. So, and I don't have any cardiovascular issues, but just those two, the level of fatigue is not what it once was. And, I rarely catch a cold. So
And
that's
how
my,
much do you take a day?
uh, 1,000.
Okay,
I
that's
take,
great.
and, not to say that I'm promoting a particular brand, but I take a little packet from Costco. Costco has like a diabetes packet, and within that is vitamin D as well as some other nutrients, which
Mhm.
I take every day.
Hmm. Great.
And that's not that expensive.
Well, right. Vitamin D is
Mhm.
incredibly inexpensive.
Mhm.
And it's one of those supplements that, isn't as complex to really, you don't have to be as careful when you're looking for the supplement or the brand because like it's not like omega-3s, right? Where you have to really learn how to read the label and make sure you're getting enough DHA and EPA and all that. No, vitamin D is pretty easy to find a high quality supplement.
Mhm.
Yes. So, um, one other question that I think is really important in terms of populations that are at higher risk, and we see a lot of the racial health disparities that could be addressed with vitamin D.
Exactly.
Do you see in your practice that because we know that the darker the skin, the longer it takes to make vitamin D, it's the sunshine vitamin, and your
Right.
body makes it when your skin is exposed to the sun at certain times of the day and year. But the darker the skin, the more sun exposure without sunscreen and all of that. Do you think it's even more important that as soon as they get pregnant or they consider that they're going to get pregnant, just make sure you're getting enough vitamin D, even more so because, and it's not
Yeah,
just,
we have
it's,
that conversation. I tell them that, the vitamins made in the skin,
mm,
there's a decreased production, the more melanin that's in the skin. And particularly if we are in a time period, like the winter time where everybody is indoors or whatever, you're not going to be out in the sunlight. That increases your risk even more of having a deficiency. So then we have conversations about getting sunlights, and sitting by those sunlights to increase the production. Um, it is something that is readily discussed. And again, when we were in the time of COVID, it was very much readily discussed, particularly not only among my melanated patients, but particularly among those who had diabetes as well.
Okay. Yeah, that's an important point. Any other higher risk populations that you would really heavily suggest make sure you're on top of your vitamin D?
Those patients that are immunocompromised, particularly my HIV positive patients or AIDS patients, yeah, those patients that have some level of immunocompromise. Mhm.
Okay. All right. Um, that's pretty much it for my questions. Is there anything I didn't cover? You with your love and motivation around vitamin D, what did I miss?
You didn't miss anything. We hit all of the key points that really need to be addressed. It's made in the skin. The more melanated you are, the higher your risk. Vitamin D is a very ubiquitous vitamin that gives good outcomes throughout the body with bone, immunocompetence, mental, cardiovascular, decreasing preterm labor, and also for those who are having problems with fertility. There's research out there that it helps with good egg production and increasing fecundity. So, um, it's a very inexpensive vitamin that does a lot of wonderful things.
Right. And of course, it is more than just a vitamin. Sometimes people hear the word vitamin, they're like, they just kind of brush it off, but it does have a lot of actions just on your genes. It acts as a hormone. But yeah, it's a phenomenal molecule that does so many different things throughout our body. Incredibly important. Um, Last question I have because I know how motivated you are to do some research with vitamin D. What is it you need to get that research going? Is it funding? Is it staff? Like, what are you looking for that we might be able to put out there and say, hey, help get this really important research done, so that we can get it out to more doctors and more patients.
Well, luckily, I am the chair of the IRB at my institution, and I am always on the lookout for collaborative uh, connections for research, and as always, as in most, funds for assistance would would be on top of the line. But as far as the ability to accrue patients, set it up from an IRB perspective, get the requisite permissions and so forth and so on, I can take care of that. But funding and staff would likely be needed.
Okay. Well, we'll put that out there for you.
Okay.
And it would be fantastic to see that actually happen. You've got the motivation. We just need the money.
Yeah. Yes. Yeah.
All right. Well, Dr. Gaither, I'm incredibly grateful, so happy that you joined us today to
Thank
share
you for having.
your knowledge and your experience and your love of vitamin D with our audience. So
Thank
I hope you enjoy the rest of your Saturday.
thank you. You too. And again, thanks again for having me. I appreciate it.
Of course, of course. All right. Bye-bye.
Bye bye.